Welcome to the Mass General Brigham OB Anesthesiology Labor Pain Management Education video series. Every woman's pregnancy and labor is different, and we believe every woman should receive accurate information about pain management during labor. There are many options to manage your labor pain using medications. You can get medication through a labor epidural, through your veins, or by breathing in medication. In this video, we will talk about labor epidurals. If you choose to receive medication for labor pain, the most common option is a labor epidural. We will first talk about what a labor epidural is, then later talk about the risks and benefits of getting one. Again, whether you would like an epidural during labor is your choice. However, there are medical reasons why an epidural may be strongly recommended. What is a labor epidural? A labor epidural or an epidural catheter is a thin plastic tube that goes in a woman's back. The catheter sits near nerves. Pain medication is put into the catheter to block nerves and pain signals. An epidural is the most effective method to lower pain during labor. Around 70 to 90% of women delivering at MGB receive an epidural for childbirth. How long does it take to get pain relief? It takes 20 minutes to put an epidural in the lower back. Once the epidural is in the right place, it takes 5 to 20 minutes for the medication to work. Pain medication can be given by a pump through the epidural catheter for as long as you need. You may even be able to press a button to give yourself doses of pain medication when you need it. Let's now walk through the steps of an epidural placement. Epidural catheters are placed in the delivery room. Before the procedure, an IV will be placed in your arm or hand. Your blood pressure, heart rate, and oxygen levels will be monitored. Your baby's heart rate and your contractions may also be closely monitored. You will either be sitting up or lying on your side with your back curved. Your anesthesiologist will help pick the best position for you. The procedure is clean, so your anesthesiologist will wear a mask and sterile gloves. They will also clean your back with soap. Numbing medication will be put in your back with a very small needle. It is normal to feel a quick poke or burning sensation during this part of the procedure. After the area in your back is numb, a second needle will be used to locate the correct space in your back. It is normal to feel pressure during this part of the procedure. Once the needle is in the right place, the epidural catheter is put in place and the needle is removed. Nothing sharp stays in your back. It can take several minutes, usually around 20 minutes, to place the epidural in your back. During the procedure, it is important to stay still and not make any sudden movements. You can get an epidural at almost any time during labor. But if the baby is close to being delivered, it could be too late. It is also important to know that some medical conditions, like problems with blood clotting or a bad infection, can make it unsafe or very difficult to place an epidural. Your anesthesiologist will talk to you more about this. After getting your epidural, you must stay in bed because your legs may be numb and you may be at an increased risk of falling. You will also only be allowed to drink clear liquids. An epidural can take away your urge to urinate when you have a full bladder, so a tube is placed temporarily to drain your bladder. An epidural can make the pushing stage of labor longer by about 30 minutes. What are the benefits of getting an epidural? Epidural pain relief is the most effective type of pain relief for childbirth. You can be fully awake during the birth experience, and an epidural reduces the stress of pain on your body. Only a tiny amount of pain medication gets into your blood, which means that it is safe for your baby. If there is an emergency and you need a C-section, the epidural can be used for the C-section and you may avoid general anesthesia. What are the possible side effects of getting an epidural? Things you may experience after getting an epidural include a decrease in blood pressure. This is treated if it happens. Epidurals do not cause long-lasting back pain, but it is common for you to have some soreness and back pain that is normal for pregnancy and delivery. Other rare side effects include itching, fever, and heaviness in the legs. What are the risks of getting an epidural? All procedures have risks. If complications occur, most are easily treated without bad effects for you or your baby. In this case, the benefits are much greater than the risks. Less serious risks include no pain relief or one-sided pain relief leading to the epidural needing to be replaced, This is more common and happens in around 5 in 100 patients. A bad headache, which occurs in every 1 in 100 to 1 in 200 patients. However, the headache is very easy to treat and sometimes does not even need to be treated. Lastly, the catheter could be in the wrong location, causing accidental injection of medication into the spinal fluid or blood vessels. This is rare. There are also some very serious risks that we worry about, but they are extremely rare. Around 1 in 1 million patients. These include a blood clot, otherwise known as a hematoma, around the spine, an infection in the spine, called an abscess, or around the brain, called meningitis, and severe nerve damage. Epidurals are generally safe. An epidural will not increase the chance of a cesarean delivery. It could slightly increase the chance of your obstetrician delivering your baby with special tools like a vacuum or forceps. Epidurals are also safe for your baby, as less medication is used compared to IV or inhaled medications. Getting an epidural will not prevent you from breastfeeding. Every hospital will have its own policies and protocols. We hope this video gives you information that helps guide your decision, but it does not replace your hospital's practices. For other pain management options, see more videos in our series.